On February 3rd, 4th, and 5th of 2020, I found myself in the emergency room department located on the first floor of the Ellis Hospital on the Knott Street campus in Schenectady, New York. The purpose of the emergency room is to quickly assess patients and their immediate needs. Many come with broken bones or abdominal pain that must be quickly assessed by physicians. Patients mainly come into the emergency department because they have a problem that needs to be solved by physicians. Patients come into the emergency room with urgent situations that must be assessed by physicians to find the root of the problem. The staff that is associated with the emergency department is registered nurses that perform triage on patients to help the doctor assess the problem that they are presented with in the department that day. EMG physicians are the doctors that can order tests and that can diagnose the patient. Other departments that the emergency room mainly works with is radiology and security. They work with radiology because a lot of patients need ultrasounds, x-rays, CAT scans, MRIs, or CT scans. And they work with security because some patients need to be restrained and they need security to alter the restraints or assess any violent acts that may be presented in the emergency room. My first day in my ER rotation was mainly watching blood work and intravenous lines be put into patients, but that also continued out through my day 2 and day 3 aspects as well. On my first day, I saw a patient with myotonic dystrophy. She had immobile hands, so they were stuck very wound and very tight, and she was unable to even open up one finger for the heart rate to go on. Therefore, they had to put it on her ear. She came in because she was dizzy and she kept falling, and she was a patient at Sunnyview. She was cognitive of everything, where everything was located in her bag, such as her medication list and her allergy list and everything. She said it had to be in the same exact spot so she was able to find it. She had a very hard time speaking clearly. The nurse was able to pick up on many of the things she was saying, and she was also cognitive that she was hard to understand, so she tried to really articulate her words while talking to the nurse and doctor. On day 2, I saw many throat swabs and flu swabs. The flu swab is a little Q-tip that goes up the nose and then is sent to the lab, and then the throat swab is the swab in the back of your throat that is also sent to the lab to test for anything that is bacteria related and strep throat. They are not able to test a airborne illness through a throat swab. On day 2, I also saw a patient in restraints because he had violent autism. He was unable to speak, so he had an aide in there with him. There was also a tech in there monitoring the patient to make sure he didn't act out violently. The night before, he kicked a nurse in the chest, and that's why he was put into the restraints. He was sedated, so he was a lot calmer when I was in the room with him. When he was eating breakfast, the nurse noticed how his arms were at a very uncomfortable position, and therefore she called security that must come down and adjust the restraints. Nurses are not allowed to do it themselves. The restraints also have to be checked every 15 minutes. The nurse also informed me that if a patient was in restraints for too long, they are sitting and staying in one position, which can cause rhabdomyolysis, which breaks down muscle tissue and affects your kidneys, which can cause serious damage to your body. The last patient I saw on my day 2 rotation was a woman with breast cancer who came in aching pain. She was unable to sit still due to the abdominal pain that she was experiencing. She seemed to be anorexic due to the lack of body mass she had. The nurse I was with said it was due to her treatments, and the patient also stated how she wasn't on her medication because her family had not picked it up for her. My day 3 rotation was, the first person I saw was a Jane Doe who was found outside the hospital. She was hypothermic with a temperature of 90.2 degrees, which is very, very low considering the lowest amount that a thermometer reads is 90 degrees. And therefore, they were almost unable to even take her temperature. With unknown patients, they put them in the computer as Jane Doe or John Doe and list them as 120 years old. When they finally figure out the patient's identity, they merge the charts into one. The woman who was found outside had dementia, and she came from Sunnyview. She had an inflatable blanket over her to keep her warm and warm her up. Throughout my rotation, she started to get progressively warmer, which is a good sign. Another patient came in with a blood pressure of 209 over 104, and he told the nurse that he had high blood pressure. And when the nurse read it, he did not seem surprised when it was that high. He stated it was normal and he felt no effects. They also had a call that they had a possible coronavirus patient. However, it did not turn out to be one. It was simply a nurse calling to see what they would do in case there was a coronavirus patient. And what they would do is they would call Schenectady County to inform them that they would have a patient so they could input the data. And they would also need to contact the CDC, and the CDC would give exact procedures and tests to run, and they would be in control of the patient. No doctors or nurses could order anything else or do anything else other than what the CDC says. The last patient I saw on my day 3 rotation was a stroke patient who came in. She had a stroke on Tuesday. She felt light effects on her left side. She had a slight facial droop on her left side. Her symptoms worsened post-stroke, so when she was at Sunnyview, her left leg slipped from underneath her while she was in the shower and she fell. Therefore, she came into the ER. The patient's whole left side was unable to lift objects or be lifted up from her body upon arrival to the ER. But when the doctor was doing a triage on her, she had much more mobility with her left side than when she first entered the ER. Lastly, for my observations are the assignments for the care teams. Care team 4 is an in and out team. They take care of broken bones, lacerations in the skin, and cold symptoms. Care teams 1 and 2 are trauma patients that come in that need immediate assisting. And care team 3 is those patients with abdominal pain. The emergency department recently had a huge advancement made throughout the entire area. Instead of using paper to document the patient's history and medical faults, they now use a computerized system that is mobile that they can use to travel with to each and every patient's room. The computer software they use is called Cerner, which is also used by many other departments at Ellis Medicine. And with Cerner, they are required to use the metric system. So patients' temperatures and weight measurements or height measurements must be used by metric units. This computerized system is on a large mobile cart. This contains wheels on the bottom so that it's mobile, a keyboard used by C-Shield that is used to type in the information, and the computer that they use is called Ergotron. This recent switch to paper to electronics happened in September of 2019. An emergency room physician makes $222,931 a year, and the projected job outlook is 7%. A registered nurse annual salary is $67,490 with a 16% projected job outlook. Both increasing numbers, and the public sector job that is present for both nurses and emergency doctors are military trauma doctors that assess fallen soldiers on the field that have been injured during fighting. They are there to help soldiers that have been injured on the battlefield and assess them immediately in a set-up tent for trauma patients. The education requirements for a registered nurse is an associate's or bachelor's degree. To enter the medical field, nurses must have clinical experience that gives them technical skills and on-hand experience before they start triage on real patients. Nurses are required to have a nursing license, and it is a computerized test that measures knowledge and skills that have been obtained through education. Nurses are also able to get credentials in subspecialties such as cardio and pediatrics and gynecology. For continuing education, nurses with associate's degrees can get their bachelor's, and nurses with a bachelor's degree can go on to get their master's. Their nurses are also capable of joining societies like the American Society of Registered Nurses to withhold their nursing license. Emergency physicians need a bachelor's degree that is obtained within 4 years, and they can also go through a pre-med program based on what college they go to and what they offer. They also need to go to med school to obtain a doctorate degree. Through med school, they can sign up to work in an ER to get rotations. These rotations help the doctors gain first-hand experience in an ER and experience the fast-paced environment it is. After med school, emergency physicians must go through residency, which is an extra 3 to 4 years, to experience all the different types of trauma, such as cardiac arrest and labor. Residency prepares doctors to get their medical license and pass their exam. They also have the option of getting their fellowship, which is an extra 1 to 2 years. Every single emergency room doctor is required to have a state license in general emergency from the American Board of Physician Specialties. They must maintain their license by continuing their education, and to do this, the American Medical Association offers online tutorials and modules, and board-certified doctors must renew certification by doing improvement activities and self-assessments. The connections I made to myself during this rotation is the use of the Cerner computer software that the nurses use to input the patient's information. I made this self-connection because of my one rotation in admitting, when I was also informed that they just switched over to Cerner, and it reminded me about how unified the hospital is. The text connection I made was a current event about how to distinguish between stroke and a heart attack. I saw both a stroke and a heart attack, and I was able to apply the information that I was given during this current event presentation to the situation, and I was able to use the different signs and symptoms I learned to help break down the problem for me. The real connection I made was that the baby boomer generation is now getting older and are aging, and many are going to be more frequently presented in the ER, and it is also opening up a lot of job opportunities for people in the emergency department because many baby boomers are retiring. The reading material that was suggested to me is to read up on and investigate the Tamiflu. The Tamiflu is a drug that is used on the flu to help treat it and prevent it. It can help weaken symptoms for 8 hours. The drug name is called Tamiflu, but the technical name is oseltamivir. I'm glad I was told to research this because the flu has been an active part of the medical field for many years, and the more information I know about it now, the more it can help me in the future. My rotation experience during the emergency room department I felt was very beneficial to me. I would go back again if I had the chance, and I felt that the people and the staff that were there really made the rotation 10 times better. The staff was very kind and nice and welcoming of me to their department. I was fascinated by the idea of becoming a physician assistant during my rotation because they seem to have a lot of patient interaction, which I really want in my future. And they also were able to talk to patients and send in tests and make professional medical decisions without running it, without needing someone else to order. Oh my God, what am I saying? I was quite fascinated by the physician's assistants that worked in the ER. I may think about pursuing a career as a physician's assistant in the ER because I was really fascinated with the work they do with patients, and the amount of patient interaction they have really intrigued me, and it opened up my mind to all the different opportunities there are in the emergency room with careers and how I may want to go into one in the future. I felt like this rotation really opened me up into the medical field because I was able to see very basic procedures done every day, but I was also able to see maybe a few out of the ordinary patients that are able to get me ready for what I might experience in the future when I'm a physician. I was exposed to all different kinds of diverse patients that were in the ER, which really helped widen my horizons of the amount of differences there are between patients and how important it is for the communication to be altered with patients who may have autism or may be really and may not be feeling very well and are at their most vulnerable point, and also to work with patients that are stubborn and very masculine who can't really express a lot of their emotions.